Hello friends, let us now learn some important points about the disease scurvy. Scurvy occurs due to the deficiency of vitamin C. This vitamin C is necessary for collagen synthesis. So whenever there is deficiency of vitamin C, this will lead to defective collagen synthesis. And the risk factor for scurvy is the child is predominantly on cow milk fed. If the child is fed predominantly on cow milk, then there is increased chances of scurvy. So in the clinical features, there is gum bleeding, petechiae, irritability are seen in a patient with scurvy. There is bleeding of gums is seen, and there is irritability, and even petechial hemorrhages are also seen. Because collagen is also necessary for wound healing, so if there is deficiency of vitamin C, there is no collagen, there is no proper wound healing because of deficiency of vitamin C. That will result in petechiae and also subperiosteal hemorrhages involving the long bones. That is, in the long bones we have, this is the long, if this is the long bone, it is covered by the periosteum. So there can be subperiosteal hemorrhages which occur in the long bone, and this result in pseudo paralysis. That means the paralysis of the limb is because of the hemorrhage but not due to the muscle or neuromuscular defect, and the baby cries on touch due to pain. Okay, so diagnosis is by X-ray. I will show you the picture in a minute. Okay, right, so this is the disease scurvy. Okay, scurvy is not generally seen in neonates, as it is required for around 6 to 12 months is required for knowing its deprivation. Okay, so deficiency, whenever there is deficiency of vitamin C, this vitamin C is required for collagen synthesis, so that leads to the defect in cross-linking of collagen, thus predisposing to bleeding. So because of that there is bleeding gums. Okay, and here if you see the patients with scurvy have this scorbutic rosary. These are costochondral prominences which we can see, and these costochondral prominences are sharp, angular and also painful and tender, which are seen in vitamin C deficiency, that is scurvy. And then I have said that there is also pseudo paralysis. See, if you see, because of the bleeding under the periosteum, this subperiosteal bleeding, a hematoma will be formed, and this hemorrhage, the baby cannot lift the leg because of this heavy painful hemorrhage, and as a result the baby stops moving that part of limb, which appears as pseudo paralysis. Okay, there is poor wound healing. Because of impaired iron absorption, there is anemia also. Other symptoms like hyperkeratosis, arthralgia and muscle weakness are also seen. Then if we do X-ray shows osteopenia, and which shows ground glass appearance, and you can see pencil tip cortex also. Just a minute, there are many signs in X-ray. Yes, okay, we will have to learn about the signs of the X-ray. So if you see, this is the periosteal hemorrhage which is seen in the X-ray, has some soft tissue mass. Then now first there is scorbutic zone. This is the scorbutic zone which you can see. First we will see white line of Frankel. So this dark colored dense zone of calcification is white line of Frankel which is seen. And there is Wemberger's area. Wemberger's area is this, Wemberger's ring or sign is this ring shaped epiphysis or shining margin of epiphysis is Wemberger's ring, and this projection in the metaphyseal area here and here, this projection is called as Pelician spur. Okay, this bony spur is Pelician spur, and we have the translucent zone which is present here. This a little translucent zone. Here you can see blackish color translucent zone which is present just below the white line of Frenkel, that is tumor field zone. That is tumor field zone. Okay, this is scorbutic zone. So these are the important markings on X-ray. Thank you for watching.